experience if elected?
Well, as I mentioned last year in my State of the State speech, I think Medicaid I think about really in the context of our overall health spending, and so a couple things. One, I do believe that we as a state government have to do a better job in terms of leveraging our role as the major procurer of health care in the state. When you combine Medicaid, state employees and retirees, the prison system, we are a major buyer of health care services, and I think we've got to really focus on how we can leverage that effort more effectively. The other thing, and this is, this includes Medicaid but goes beyond Medicaid, and it goes beyond Delaware, we've got to move away from what has become a sick care system where providers get paid based on how many procedures they do, and move toward a health care system where providers get paid based on keeping people well at a reasonable value. Now, I will tell you, I think it's amongst the most complicated public policy challenges we have across the country. I think there are a couple other states that are taking a lead. We're keeping a very careful eye on that. But you're absolutely right to identify it as a hugely important issue, because if you look at the state's budget over time, health care has eaten up a bigger and bigger portion.
Thank you, Governor. Let's get our next answer from Green Party candidate Mark Perry.
Well, the Green position is we need single payer, and I think that is benefits to business. Why should businesses be in the business of helping providing health care? We need to expand Medicaid across the board, and yes, manage the costs. But I think we can do that. Government, again, is not necessarily inefficient or essentially inefficient or evil. It can be done.
Mr. Craig?
I think the governor's absolutely right in his State of the State message, and really beyond just the state and the federal government, these health care costs that are growing at 8 to 10% a year conservatively, some years double digit, is a major issue for us going forward and our ability to finance that and to pay for that. I worked for 24 years in the life and health insurance industry, primarily dealing with these issues with large employers and with pools of smaller employers that dealt with these costs. The absolute key, it's this sick care, well care thing kind of misses the point. What it is essentially about is empowering people to make good economic decisions themselves. The system is stacked against you as an individual. They roll you into the hospital. You don't know what it's going to cost you per day that you're in there. You don't know what those procedures cost. And the entire system is designed to obfuscate what those costs are. I'll use a very, very personal story, and I'm going to go by the 1 minute here very quickly. But my wife was in a head-on auto collision in which she broke the 2 little fingers on her hand. She was actually pregnant at the time, and so she refused to have a x-ray done. She was concerned about the effect an x-ray would be having on the child she was carrying. The emergency room put her all through the paces, demanding that she have an x-ray, when the issue essentially was a couple extra $100 in cost for something that they would tape the finger to her other finger regardless of whether she had the x-ray or not. What we need to do is empower individuals through additional information, and we need to move away from a centralized purchasing system of healthcare to a diffused system. Market forces work in healthcare if we set it up for market forces to work.
Can I ask a follow-up on this? Governor Markell, you've essentially agreed to expand Medicaid under President Obama's health reform law. It'll add, the state's estimating about 20,000 residents to the program. Do you agree with that, Mr. Craig?
I don't. I think what it is, it's more bad policy, doubling down on bad policy. The larger we make this a responsibility of government, the more that government assumes to say we can make good decisions. And this is the theme that goes back to the Bloom and the Fisker investment and everything, you know. When government reaches its hand, it has the best of intentions. The idea is to actually improve health care for those 20,000 people. I think the longer term consequences is we reduce health care choices for everybody. And you have to remember that health care expansion is paid for by a federal government who today is borrowing 40 cents of every dollar it spends. The idea that we can double down and do more of the same, it has the best of intentions, but it is absolutely a wrong-headed move. What we need to move is the opposite direction and empower people individually. We need to get those people to work. We need to get the people that we can off Medicare, and we need to reduce the size of that program, not increase a program that's going to grow double digits ad infinitum.
So the alternative to that is unfortunately where we've been, which is those people, those additional 20 or 30,000 people, don't get care. They go to the emergency department, or frankly, before they go to the emergency department, they get sick, and then they get sicker, and then they get sicker still. And finally, they go to the place that is the most expensive place of all to get care, which is the emergency department. And so it's an incredibly ineffective way. Christiana Care actually has a program they're piloting now, where they're taking their super heavy users of the emergency department and diverting them before they get to the emergency department, which I think makes sense. So the reason that I believe the expansion makes sense, number one, it provides opportunities for those people to get care someplace other than the emergency department. Secondly, the math. This is about the finances, and from the perspective of Delaware taxpayers, the way this deal works with the federal government, we will get a higher reimbursement for people that are already being seen. So it's actually better for Delaware taxpayers.
This is about growing government and growing the obligations you have in terms of taxes to government. It plain and simply is a exponential increase in government's reach, and I am not sure we have better outcomes for those people who are getting treated. People get treated for health care today. You know, people are not lying on the streets without care. We need to provide better care, but providing better care is not through increasing the government's share and the government's responsibility.
So how would you take these 20 or 30,000 people who unfortunately aren't working, who qualify for Medicaid, and who could qualify for Medicaid? How would they get their care under your?
Well, short term, yeah, we have to provide care for them. We can't leave people without
That's
care.
different. So how long is the short term?
Well, what you're proposing is a permanent expansion in the Medicare eligibility that will go on for years and years.
This is about Medicaid. It's
Well,
not about
Medicaid. Medicaid expansion, a permanent expansion for Medicaid for an additional segment of our population, which will wind up sitting on Medicaid for the next 20 years and will bankrupt the state budget.
No, actually, that's just not right. I mean, if you look at and we've done a very careful analysis of the math, the state budget is actually better off because the federal government's going to pick up a bigger portion of the reimbursement for people that were already treated.
You're just cost shifting. You're just moving it from the state pocket to the federal government pocket, and it's not really a solution.
No, look, my job, I am the governor of the state of Delaware. My job is to look out for the taxpayers of Delaware. And so from the perspective of the state government, from the perspective of state taxpayers, and from the perspective of the 20 or 30,000 additional people who could be treated, what is a better option? This is the best
The
option.
real solution is getting people back to work, increasing income in the economy, increasing opportunities for people, and then also having people be more responsible for their own health care. There's always going to be a core group of people, children, the elderly, that you have to provide for, but people of working age should not be able to rely solely on the state. And this is the camel under the tent, the nose of the camel under the tent. Next thing you know, you're going to be saying we need to have nationalized health care for everybody.
We need to have
Everybody gets it
nationalized
from the
health care
federal
for
government.
everybody.
Dr. Henry is saying that. So, I don't believe that we should. I also don't believe in a single-payer solution here in the state of Delaware. There's no question, job number one, and I think it was appropriately addressed at the beginning of this forum, is to focus on getting as many people back to work as possible. But in the meantime, you made you sort of changed your position for the short term. I don't know what the short term means to you. And I think, that we have a decision to make now. Are we going to expand? I can tell you, I was very clear with the federal government that we need the ability, if those reimbursements don't continue, we need the ability to scale back because we can't be in a position where Delaware taxpayers could be left on the hook.
Why should your health care be dependent on whether you've got a job or not? Why does that have to be connected?